Here at ASCO 2013, I'm Thomas Baldrick with the opportunity to speak with Sunil R. Hingorani, MD and PhD. He is from the Fred Hutchinson Cancer Center in Seattle, Washington, and also works at the University of Washington. Thanks for stopping by, sir.
Pleasure. Thank you, Thomas.
So you have a poster on stage 4 metastatic pancreatic cancer. Can you give us an overview of that?
Sure. In this particular study, what we did was we tested a novel agent, PEGPH20, or a PEGylated form of an enzyme, in combination with the current standard of care, gemcitabine, for pancreatic cancer.
Well, let's start with what is PEGPH20 exactly in more detail.
Sure. So PEGPH20 is an enzyme that specifically targets a molecule that's expressed at very high concentrations in pancreatic cancer, and in particular in the matrix, or the surrounding environment of the tumor cancer cell. And what the cell does is puts out a large amount of this material, and it effectively acts as a barrier, as a shield, preventing chemotherapy from effectively penetrating into the tumor bed. What PEGPH20 does is it digests that shield, and it enables chemotherapeutic agents to get in sufficient concentrations to actually kill the tumor cells.
Now, how does it work in combination with gemcitabine?
Well, so gemcitabine has long been used in pancreatic cancer, and in general it tends to have a fairly modest effect. And that's primarily because it has a short half-life in the circulation, so it's rapidly degraded, it's rapidly cleared. And because blood flow to a pancreas tumor is decreased rather than increased, as we find in most solid tumors, very little of that chemotherapy actually gets into the tumor. And what PEGPH20 does is allow more of the drug to get into the tumor so that it can have its effect.
What is hyaluronin, and where is it found in tumors?
Hyaluronin is the specific target of PEGPH20, and what it is actually a rather simple but very long sugar polymer. So it's composed of 2 different kinds of sugar molecules in a long extended chain. And what that does is it actually complexes with a large amount of water and creates a pressure inside a tumor that makes it very difficult for blood to flow in and for molecules to flow in. And so gemcitabine, being one of those molecules, again has a difficult time getting into these tumors, and degrading that hyaluronin is what enables the chemotherapy to get in.
What do you think the data says about the future of PEGPH20?
So in this early trial, what we were primarily doing was to look for the safety profile, to examine the safety profile of this agent in combination with gemcitabine. And what we learned is that it's very well tolerated at doses that can give you an effect in the tumor. So we saw responses within the tumors of these patients in ways that correlated with hitting the target, quote unquote, and removing the specific substance, namely hyaluronin, which we could show in biopsies. And that correlated both with an increased blood flow, as we'd expect, and increased activity of the chemotherapy. So moving forward, what we'd like to do now is a randomized trial where we test this hypothesis formally. We're adding the enzyme with the current best chemotherapy and comparing that to just chemotherapy alone to see if in fact it can improve its effect.
Very good. Thanks for stopping by and sharing your work with us, and best of luck in the future.
Thank you very much.